Hey guys, I think it's about time for me to create another Q&A video, and I've been getting a lot of questions in the comments section. I've been trying to be as attentive to them as possible, but I think some of them merit greater attention just because of the quantity of times I've been asked the question and also because of the importance of the question. So I think I might as well just go ahead and get to it and just start with the first question. And these don't come from any specific individuals. In fact, these are not verbatim. These are just a summary of some of the questions that have been asked more frequently than others. So the first question is, I'm interested in starting Finasteride and Lonatin. How do I get a prescription? Okay, let's go over the first drug first. Dutasteride, for those who do not know, it's kind of like super finasteride. It's about 30% more effective than finasteride, and if it is prescribed, it's simply prescribed either for benign prostatic hyperplasia, BPH. That's actually the only official use for it in the United States, and I think in the United Kingdom. I think in some countries, like maybe some countries in Asia, it actually is prescribed for male pattern baldness, but it is also prescribed off-label for male pattern baldness in the United Kingdom, in the European Union, and in the United States. And a lot of times just a GP will prescribe it, but if you're having trouble with a difficult GP who doesn't want to give you a prescription just for whatever reason, then go find a hair transplant doctor. Find a hair transplant doctor and tell them that you're on finasteride. Whether or not you are on finasteride doesn't matter, and just tell them that you're losing some ground, and they will almost certainly write you a prescription for dutasteride because they're hoping for business from you, and they think that you might not want to do business with them if they're not nice enough to write a prescription. So you can almost always count on a hair transplant doctor to write a prescription for dutasteride for you. However, I do recommend just trying to go with finasteride first. Give it 6 months, because even though dutasteride does work better, with greater power comes greater risk of side effects, and chances are finasteride will work well enough for you, because finasteride is a very good drug. It suppresses about 68 to 75% of DHT. For people who take a 1 milligram dose, and even people who are at a reduced dose, like 0.5 or even a quarter of a milligram dose, they could still get at least 60% DHT suppression. So start with that first, but if that doesn't work, that's how you get a prescription for dutasteride. Now, as for the latter, Lonatin, for those who don't know, Lonatin is oral minoxidil, which is obscure, but it is used by some people for male pattern baldness. I've used it myself. I created a video on it, and like I said in that video, it is by far the strongest thing I have ever used. It created so much hair growth, I practically had a mop by my head, and it also caused hair growth all around my body, so it was extremely powerful. However, using it is extremely risky since it's prescribed as a last-ditch drug for people who are suffering from heart failure, cardiovascular disease, and doctors will prescribe Lonatin for those patients when statins and ACE inhibitors don't work for them. So no GP or like a dermatologist in their right mind is going to write a prescription for Lonatin for you, especially for hair loss. So the only way to get a legit prescription for Lonatin is if you have heart disease and the more conventional pharmaceutical treatments haven't worked for you. So the only way to get Lonatin for hair loss is to get it through the gray market. I'm not going to provide any sources for that. I don't want to get my channel deleted. And that being said, I implore you guys not to use Lonatin. It is not a long-term treatment. And even if it's really, really strong, any results you get from it are going to go away when you stop using it, even if you switch to topical minoxidil, because topical minoxidil is not nearly as strong. I've been asked about that. So just forget about Lonatin. I mean, if you have to use it because of heart disease, go ahead and use it and reap the benefits of the hair growth. But if you're using Lonatin for heart disease, I think you have much bigger things to worry about than freaking male pattern baldness. So just don't, please. Just don't use it. It was a mistake for me to use it, and I'm lucky I stopped when I did. All right. The second question doesn't relate to hair loss, but I want to assure you guys that I am going to get back to the hair loss subject, so, don't close the video. What do you think about Jason Blaha Koth? Jason Blaha is one of the biggest idiots in the fitness industry. Now, he does give pretty sound fitness advice, but it's not fitness advice that isn't just basic common sense that you can look up from any other fitness channel. So what he'll basically do is that he'll advocate for simplicity in training, which is good. He'll talk about, like, conventional lifts, conventional movements such as like squats, hinges, presses, and pulls, and just applying resistance to them and using progressive overload, which is fine and everything, but that's just common sense. I mean, anybody can look that kind of stuff up. You don't need a strength coach like Jason Blaha to tell you that squats, deadlifts, and bench press are good. But other than that, what he'll do is that he'll just go after anyone else in the fitness industry to make a name for himself, and he'll constantly change his philosophy when it comes to fitness and diet just to remain relevant. because he's creating like 20 videos a day. To give you an example of that, when he first started off, he was like this liberal hippie vegan, and then he rebranded himself as this gun-toting carnivore Texan guy, and then again he started defending veganism, and now he's ketogenic diet again. So the guy's just completely full of shit. He invented this fake mercenary persona background of himself just to make himself sound more like a badass, which is pretty funny because, you know, I'm not one to bash anyone's physical appearance. I mean, I think that if people are going to the gym, whether or not they're beginners or elite, I mean, I think that's excellent. I would never trash anyone, but I'd make an exception in Jason Blaha's case because he makes a career on YouTube by trashing other people. But this is a guy, by his own admission, who uses a ton of steroids, and I think he's living proof that steroids can't cure Klinefelter syndrome, and I'm not even joking. I think he really does have Klinefelter syndrome. I mean, if you look at this guy, he has this curvaceous hourglass physique. He's like this really ugly woman, and you'd think he's a woman if he weren't so damn hairy, and his fat distribution is like that of a woman. I wouldn't be surprised if there's enough estrogen in Jason Blaha's body to convert an NFL team into ballerinas, because his estrogen levels are so high, even though he doesn't have very much hair, so who knows. I mean, you'd think if he had all that estrogen, he'd at least have his hair, but the guy looks like absolute shit, and his strength numbers aren't very impressive either. I mean, I think his bench press is about like 340. I've bench pressed 340 before, and I probably weigh about 60 pounds fewer than Jason Blaha, even though I'm like maybe 5 or 6. I'm 6'1". I think he's like 5'7" or something. But also, his best deadlift, I think, is 585 pounds. Now, to layman's, that might sound impressive, but for someone who's using a shitload of steroids, like I think he injects himself full of testosterone, he puts trenbolone up his butt or something like that. I'm sure he puts a lot of other stuff up his butt too. For somebody who's on that many steroids, not even being able to deadlift 600 pounds when you're weighing over 200, 250 pounds is not that impressive. And for someone who talks so much shit about other people's strength, he's in no position to brag himself, especially for someone who isn't even a natty. So the guy's completely full of shit. He's a liar. And even if he does occasionally make sense, you can't trust somebody with that dubious of a background. So yeah, he's a total asshole. Fuck him. Anyways, let's move on to the next question. Are the side effects of finasteride permanent? Now, I've talked about this a lot, but I want to go ahead and reiterate this again. No, the side effects of finasteride are not permanent. So when people are talking about the side effects of finasteride, they're usually talking about neurological side effects, or they're talking about the sexual side effects. Now, the sexual side effects people are a little bit more worried about. I mean, nobody cares about going brain dead, but if their dick doesn't work anymore, everybody's gonna freak out. But the neurological side effects are a little bit more interesting, and the idea is that they somehow relate to a neurosteroid called allopregnanolone. I think that's how I'm pronouncing it, and that is responsible for just like mental well-being, mental health. So that's maybe the reason why some people get depression as a side effect. And if you are getting side effects like mental health side effects from finasteride that are causing depression, that in turn can also lead to sexual side effects, since depression causes erectile dysfunction. But the good news about that is that even if that is like a problem for you, even if you have a chronic problem with your allopregnanolone levels, there is a drug that's coming out, and the chemical name is Sage 547. I looked it up, and this is going to be like basically just an injectable synthetic form of allopregnanolone. So even if for some reason finasteride screwed up your allopregnanolone levels, you can just go ahead and use that drug and like get it back to normal levels. But that's assuming finasteride even caused that to begin with, which is like not something that can be verified. But there's something around the corner for people who do think they are having a problem with their neurosteroid levels, whether it be caused by finasteride or not. Now, getting into the sexual side effects, no, finasteride cannot cause irreversible sexual side effects. And you'll notice these people who say that finasteride gave them permanent side effects. I noticed one interesting characteristic is that they say the negative side effects of finasteride stayed with them, yet when they stopped finasteride, the positive things that finasteride caused, such as keeping your hair, those didn't stay with them. So why wouldn't that stay with them if the effects of finasteride are prolonged? Wouldn't the benefits of finasteride stay with them as well? So I think it's complete nonsense. In fact, there's strong evidence that finasteride is the side effects are psychosomatic. In fact, I want to go ahead and read this this abstract from an article I found on a Karger website. And it's an abstract of a greater opinion piece. You have to pay for it. But anyways, I thought it was interesting. I'm going to go ahead and just read it real quick. But it says that Post-finasteride syndrome has been claimed to occur in men who have taken oral finasteride to treat either hair loss or benign prostatic hyperplasia, independent of age, dosing, or indication. By definition, the condition is characterized by sexual dysfunction, somatic symptoms, and psychological disorders that persist after cessation of finasteride treatment. As yet, the condition is not recognized by the medical community, although individuals who suffer from PFS present with relatively homogeneous symptoms. The concept of PFS has emerged from reports of non-dermatologists, neuroendocrinological research and reflections, and uncontrolled studies of low quality and with strong bias selection. That's important. These studies are very, very biased. While a significant nocebo effect among patients informed about possible side effects of finasteride is recognized, there is no predictive factor for the risk of development of PFS. That's important. No predictive factors for the risk of development of PFS. Nevertheless, it has been suggested that a patient history of pre-existing mental health disorder, particularly depression, may put patients at an increased risk. We report the first case of PFS in a long-standing, over 20 years, dermatotrichological practice with frequent finasteride prescription observed in a 25-year-old male following dutasteride treatment for male androgenetic alopecia. There was circumstantial evidence that PFS may represent a delusional disorder of the somatic type, meaning that it had to be caused by the brain. Possibly on a background of a histrionic personality disorder, which would explain the refractoriness and the condition and a high degree of suggestibility. So basically, people who have post-finasteride syndrome, which is basically a made-up condition, it's all in their head. It's just a mental health disorder. So if you have a history of mental health problems, in that case, you may not want to consider finasteride, because the nocebo effect is going to be, the power of the nocebo is going to be so strong, the suggestion is going to be so strong that you're going to convince yourself that finasteride has caused these side effects, regardless of the science or regardless of what anybody has said. And I feel really sorry for these people on the Propecia Help forums, because, you know, they are so far gone out there that even if like some sort of treatment for their imaginary condition were to come out, they probably wouldn't believe it actually works for them, because they're just so convinced that they're beyond hope. And, you know, I think if it weren't for finasteride, they'd find something else to blame for their problems, because, you know, let's face it, a lot of these people are unhealthy, they are overweight, they're diabetic, they're depressed, and all those conditions can lead to sexual dysfunction. It's just that now that they have this scapegoat with finasteride, they have something they can pin all their frustrations on and hopefully make some profit out of it through a lawsuit. And you know, lawsuits and litigation is heavily advertised on those websites anyway, so it's clear that these people are trying to make a lot of money off of their imaginary fake condition. And you know, a jury's going to be ignorant about the science behind the side effects of finasteride, so they may be sympathetic enough towards these plaintiffs that they'll actually reward them with a lawsuit, and it's been done before. So no, the side effects of finasteride aren't permanent. I recommend people watch my other videos on the subject. I mean, I uploaded some videos recently to just get some more information about it if you guys are curious, but there's a lot that could be said about it, and I'll probably talk about it a little bit more further, but that's all I'm going to say in regards to that question. So anyways, another question is, what happens if you stop taking finasteride? Okay, if you stop taking finasteride, the only thing that's going to happen is that your DHT levels are going to rise back to their normal levels, and your hair loss will gradually continue again. So if that is, unless of course you replace it with another form of treatment like RU58841, or even a more conventional topical anti-androgen like alpha-estradiol. So just expect that the results you got from finasteride are going to reverse, and don't expect to keep the benefits of finasteride. So with any hair loss treatment, just remember it's going to be long-term. You want to go ahead and stick with the treatment. You can't expect, there is no cure for male pattern baldness. I mean, the cure is basically starting treatment and never stopping. There's only a treatment that has to be used continuously. So in the meantime, the best thing we have right now are anti-androgens as well as growth stimulants. So yeah, it's a long-term commitment. If you don't want to lose your hair, then don't stop finasteride. Okay. What do I think about derma rolling? You know, I'm kicking myself right now. Actually, I had a prop. I have a derma roller. I forgot to grab it out, but you can easily buy a derma roller from Amazon, from various websites, eBay, and there are various lengths, but they all work about the same. And I like derma rolling. Now, there is a study out there that showed that, like, you know, it was a very small study. The sample size was about 4 people, and it showed that derma rolling actually did help with tissue repair and hair growth. But, you know, that's way too small of a study to draw any conclusive evidence from. But what I do think it helps with is that I think it helps with the absorption of topicals. And I created a video a long time ago about how to create the ultimate treatment for hair loss. And I talked about, like, you know, mixing various topicals into a shot glass, and I talked about using tretinoin, RU5-A41, stamoxetine, minoxidil, and just mixing them all together. And, you know, you have various good compounds right there. Like stamoxetine is a decent hair growth stimulator. Tretinoin on the scalp I think is good too, because it increases skin exfoliation. I think that can actually improve absorption. I think there's actually evidence that shows that tretinoin can help improve absorption of the topicals on the scalp. And I think by creating like micropunctures into your scalp with a derma roller can also help increase absorption. Now, I don't think it's necessary, but I figure that, you know, there's no side effects. It's pretty easy to use. It's not painful at all. A derma roller is pretty cheap. I've only been through about a couple in the like at least decade or so since I've been fighting hair loss, so they last a pretty good while. Just make sure that you don't share them with anyone, because, you know, there could be like a risk of like diseases. I mean, there's no blood or anything, but, you know, just to be safe, you probably don't want to share it with anybody. But I like them. I wouldn't ever rely on them as a standalone treatment, but as an adjunct for other existing treatments, I do think they're pretty good. So anyways, this next question also pertains to something I've addressed in the past, and my answer hasn't changed much, but there is something I do want to say about it, at least anecdotally. And the question is, does creatine cause hair loss? And the short answer is no. I do not think creatine causes hair loss. And the reason why is because if creatine actually raised DHT, it would have been taken off the market a long time ago. So creatine, what it is that it's an amino acid that our body produces naturally, but it's also found in trace amounts in certain foods, mostly animal products. But there's not nearly enough creatine in any food to create the saturation that will give us the ergogenic benefit that creatine supplementation has been shown to do. Now, having used creatine, I think it doesn't really give me much strength, but it does help improve my volume in the gym, so I can handle just a little bit more work. So if I have extra time to commit to the gym, I may not just do deadlifts, but also do deadlifts and overhead press as well, because I have enough energy left over to do it. So it doesn't increase my maximum lifts, but it just lets me improve my strength endurance a little bit, which is good because you want to get a lot of volume in the gym. So it's a good supplement, and, you know, as far as legal supplements go, it's probably one of the only that actually work. And there is a study that shows, it's a relatively small study. I think it was about 20 participants, and there was like a team of rugby players, and it did show like a pretty substantial increase of DHT. I think it was like 20 to 30% or so, and that is substantial, but it is a pretty small sample size. However, I gotta say that recently I was experimenting with creatine, and I was taking like 20 grams a day, which is like a loading phase, and I figured, let me go ahead and just stay at that for a couple weeks. And after about a couple of weeks, I did notice a little bit more shedding in the shower, and this doesn't prove that creatine raises DHT, but it did make me a little bit concerned, so I went ahead and I lowered my dose to just 5 grams per day. And after that, the increased shedding just stopped. I mean, there's always going to be some hair turnover, which is going to cause, like, you know, like some hairs to fall out in the shower, because that's when you're applying a lot of friction on the scalp. But I think that I get the same benefits from 5 grams of creatine versus 20 grams of creatine. So maybe creatine does raise DHT a little bit, but you have to use a shitload of it, and that's not necessary, since you can still get most of the same, if not all the same benefits from just using like 5 grams per day. So I wouldn't really worry about it. So if you think that creatine causes increase in DHT, I mean, maybe it does, maybe it doesn't. I mean, you can counter it by using something like Finasteride, but, you know, just to play it safe, maybe don't take a really, really large dose of it. But like I said, I don't think it really can cause that much of an increase in DHT, because DHT is responsible for a whole host of health problems. Like, it can contribute to certain forms of cancer, like prostate cancer. It can cause enlarged prostate, acne. So if it caused hair loss, we'd also see it cause those other problems as well. So I wouldn't worry too much about it. I think it's a relatively safe over-the-counter workout supplement. So next question is, what advice do you have for teens who are losing their hair? And I'd go ahead and extend this question to people who just can't use Finasteride, because they're part of the small group of people who can't use it because of side effects. All right, but if you're a teen specifically, what I'd do is, first of all, how late into your teens are you? Are you like 14 or 15? And, you know, don't be ashamed. There are some people who actually do start losing their hair at 14. I remember I saw a picture of a 14-year-old who was a Norwood 3, and that was just a horrifying thought. I mean, it's bad enough losing your hair when you're in high school, but I mean, in college, but I can only imagine how bad it would be if you started losing hair in high school. So, anyways, chances are, if you're a really, really young teen, you don't want to take Finasteride, because even though DHT doesn't have much role in the adult male body outside of just the scalp and the prostate. It does play a role in the maturation of adolescence. So you probably don't want to suppress DHT if you're still growing. So in that case, I'd talk to your doctor, and he'll probably tell you to use minoxidil. And you can also take an over-the-counter anti-androgen like alpha-tridol, or you can take another hair growth stimulant like stamoxetine. And stamoxetine actually works a little bit differently from minoxidil, so you can stack them. And the way stamoxetine works is a little weird, kind of like minoxidil, but what it does is that it kind of emulates a state of hypoxia, which in turn, for some reason, prolongs the anagen phase of the hair follicle, which just is the growth phase of the hair follicle. And you can use it in cycles of 3 months, or you can use it continuously. And as far as why minoxidil works, there's various theories, but we're not quite sure about the mechanism, but we know it's independent of androgens, so that means that teens can probably safely use it. But just make sure you talk to a doctor, because you don't want to mess around with any kind of drug without a doctor's supervision, even an over-the-counter drug like minoxidil. And hopefully what those drugs can do, even though they're not good long-term treatments, is that they can buy you enough time until you're an adult, like when you're 18 or 19, and then you can take finasteride. And also something like alpha-tridol, even though that's not as strong as finasteride, it does suppress androgens on the scalp. It doesn't suppress as much as finasteride. It's not as effective, but it could be good enough to buy you enough time until you're ready to take something like finasteride or dutasteride. So that's what I'd recommend. And if for some reason you go bald and all treatments fail, then look into a hair system. A hair system is basically a euphemism for a very, very high quality wig. Now, no guy likes the idea of wearing a wig, but seriously, Google hair systems. They are really, really good. They're not like the toupees of the 70s and the 80s. They look way better than any natural hair can ever look. And they can be a little bit of a pain in the ass to maintain. You have to get them changed every 6 months, but it's worth it for the aesthetic benefit, I think. In fact, if I were to lose my hair, I would have no qualms whatsoever with getting a hair system. So anyways, another question I just got asked is, can you do a video about inflammation? Well, I guess this is going to be my video about inflammation, but does inflammation on the scalp cause hair loss is what I want to talk about specifically. And no, it doesn't cause hair loss. It sure as hell doesn't help, though. And the problem with having inflammation on the scalp is that it can make it difficult to apply topicals. And that's not good, especially if you want to use topicals, because that can further exacerbate the inflammation. So you want to get the inflammation under control before you add a whole bunch of new products to your scalp that are designed to fight male pattern baldness, like minoxidil, especially if you're sensitive to things like propylene glycol and alcohol solutions. So I am I know people who have seborrheic dermatitis. I'm not sure how that's actually pronounced. Forgive me. Seborrheic dermatitis, which is the condition which causes inflammation of the scalp. And I've never been officially diagnosed, but I do think I suffer from the condition myself, since I do get pretty bad dandruff. And the best thing I can do, other than tell you to talk to your doctor, is tell you what I do personally to keep it under control, and it does work for me, is that I'll use Nizoral once weekly or twice weekly. I don't use it more frequently than that because it's very drying. And even though Nizoral is often popularized for its alleged hair loss fighting capabilities, I do not think it's an effective treatment for hair loss, simply since it doesn't stay on the scalp long enough. Even though the active ingredient ketoconazole, which is an antifungal medication, has been shown to have anti-androgenic properties, ketoconazole is only on the scalp for about 5 minutes when you use it as a shampoo, so I don't think you're going to get the benefits of it. If you want to use ketoconazole as a hair loss treatment, then I'd look into the ketoconazole Nizoral cream as opposed to the shampoo. But getting back on point, Nizoral 1% I think is very good if you use it once or twice per week. And on the other days when you shower, whether you shower every day like I do or you shower every other day, I will use a coal tar shampoo. Now, if you shower frequently, you're going to get some pretty severe scalp dryness. So what I do is look into jojoba oil. And jojoba oil is really good because from what I've researched, jojoba oil is the oil that best replicates the sebum that our scalp produces naturally. So just taking a couple of drops of that, adding it to your conditioner, or just adding it to your hair after you shower, massaging it in really well, combing it in, is a good way to kind of counter the greasiness. But I should also point out that a lot of the dandruff you're going to get while fighting male pattern baldness, especially if you use minoxidil, is going to be just dried minoxidil flakes. So that's why I'd recommend investing in a shower comb. And I forgot to bring it over here, but anyways, a shower comb is a plastic hard tooth bristle comb. You can buy them from like stores like Aveda. You can buy them from Target, or you can just look one up on Amazon.com. But just like really thoroughly run that through the hair, and any residual dandruff you can just go ahead and scrape off after that. So anyways, okay, good. All right, so other than that, like other questions I want to okay, so let me just there's also some other questions I got asked that aren't exactly hair loss related. But I also got a question about The Witcher 3, and they said, like, I noticed you have, like, some Witcher memorabilia in your videos. Are you a Witcher fan? Yes, I am a really, really big Witcher fan. In fact, here's an ornament that I just got recently that I'm going to put on my Christmas tree. The Witcher is my favorite video game series of all time, and The Witcher 3 is my favorite game of all time, and I'm a really big fan of those big open-world, story-driven games that you can kind of get lost in. And, you know, this is not going to be a gaming channel or anything. I mean, there's plenty of that content already on YouTube as it is, but I am a huge fan of The Witcher 3. I've beaten it like 5 times. I platinumed it on the PS4. I played it and beaten it on multiple platforms. Right now I'm playing the Switch version, and I don't think any world has ever felt as alive and fully fleshed out as the world in The Witcher 3. So I'm just a really, really big fan of that. So, anyways, there's other questions I can go over, but I'll save that content for another video. Oh yeah, last question I actually want to talk about. It's like, why the hell don't you upload more frequently? I'm sorry about that. I am going to upload more frequently. It's just the thing you guys got to keep in mind is that, like, I'm not like a full-time YouTuber. I mean, I don't intend on becoming a full-time YouTuber. I'm not financially motivated. I actually have plenty of money already as it is. So I just do this kind of stuff as a hobby, although I do genuinely enjoy sharing this information. So I do want to do it more often, and I appreciate everybody's patience with me, and I want to assure you guys that more content will be coming soon. I just don't want to become too repetitive. In any case, thank you guys for watching, and I will be back with more content soon. Thank you.